Hello everyone, welcome to LUMP Special Lecture Series featuring Basic TCM and Tongue Diagnosis Made Easy, Day 9 of 12. Today we shall talk about Shen disturbance, yin deficiency and empty heat, purple tongue, sublingual veins. Generally speaking, the progression of severity of emotional stress according to the tip of the tongue is as follows. Normal color, red tip, red body, red tip, red body and tip with red points, red body with red swollen tip with red points, red body, red tip, heart crack, red body, red tip, stomach heart crack with sticky dry yellow coating inside it. The tongue shows conditions of indeficiency and empty heat clearly. It is important to understand that although empty heat derives from indeficiency, it takes time for it to develop. Therefore, a patient may display all the signs of indeficiency on the tongue for several years without developing empty heat. And the tongue shows this clearly by being of a normal color and lacking a coating. A tongue without coating indicates indeficiency first and foremost of the stomach. In addition, it may also indicate indeficiency of the kidneys, liver, or heart. In fact, indeficiency manifests on the tongue with a lack of coating. Therefore, a tongue without coating but of a normal body color indicates indeficiency without empty heat. As indeficiency aggravates with time, empty heat may develop and this turns the tongue red. Therefore, empty heat on the tongue is manifested by a red body color together with the absence of coating. One often hears that in indeficiency, the tongue is red, a statement that is tempting to make since in yang deficiency, the tongue is pale. This is not so. In indeficiency, the tongue lacks a coating and has a normal color. In empty heat, the tongue lacks a coating and its body is red. That indeficiency can occur without empty heat is demonstrated by tongue diagnosis, as many patients have a tongue that lacks a coating, indicating indeficiency but is not red. The tongue on the extreme left partially lacks a coating, and the other coating is rootless, which means indeficiency and has a normal color, no empty heat. The tongue in the middle lacks a coating, so yin deficiency, and has a normal color, no empty heat. The tongue on the right lacks a coating, yin deficiency, and is slightly red in the center, which means the beginning of stomach empty heat. The tongue on the left lacks a coating and has cracks, so that's yin deficiency, and is of a normal color, no empty heat. However, it is slightly redder on the front third, indicating mild empty heat in the lungs. The other tongue lacks a coating, yin deficiency, and is not red, no empty heat. However, it is also purple, indicating blood stasis. This tongue lacks a coating, yin deficiency, and is red, empty heat. No coating means indeficiency. No coating, red body, indeficiency with empty heat. Now, a red tongue with coating is full heat. Red tongue without coating is empty heat. Indeficiency and empty heat are not formed in a short space of time. It takes years for them to develop. The tongue shows clearly not only the present condition, but also the stage it is at. Therefore, it also shows where it is developing from and what it may lead to. The three stages of the formation of indeficiency are rootless coating. This is the mildest form of indeficiency. Coating partially peeled, coating missing completely. Empty heat may develop at any of these stages, but it is more likely to develop at the third. This tongue shows a coating that is missing in the center with a red center. So this is clearly stomach indeficiency with stomach empty heat. Degrees of yin deficiency. Yin deficiency is a gradual process which develops over years. The absence of coating in a tongue with a normal body color indicates fairly advanced yin deficiency but without empty heat. The following slides are illustrations of varying degrees of yin deficiency. So the first tongue, the coating is missing entirely. The color is normal. So this is stomach yin deficiency with no empty heat. Note that the tongue is also swollen and therefore there is phlegm. Tongue number 2, the coating is entirely missing, slightly red body. So this is yin deficiency of the stomach and possibly kidneys with some empty heat. The widespread presence of cracks indicates a deeper stage of yin deficiency. Tongue number 3, the coating is entirely missing, red body. This is yin deficiency of the stomach and possibly kidneys with empty heat. The presence of a heart crack also leads us to deduce that there is possibly also heart yin deficiency. This other tongue is entirely without coating everywhere. So this is deficiency of yin of the stomach and kidneys. As the tongue is also deep red, there is intense empty heat. This is very severe yin deficiency and this patient had liver cancer. It takes a long time in general for a tongue to become purple and therefore a purple tongue usually indicates a chronic condition. The only two exceptions to this are trauma and surgery, after which the tongue becomes purple in a matter of days or hours. It is important to remember that the purple color is not always obvious as it is often quite subtle. As a rule of thumb, we would say that if a tongue is not of a normal color, not pale nor red, the chances are that it might be subtly purple. It is important to be able to recognize a purple color because it is clinically very significant. A purple color always indicates blood stasis, which potentially causes serious diseases. For example, coronary heart disease, cancer, and stroke. As indicated earlier, tongue diagnosis allows us not only to diagnose the pathology, but also to assess the degree of the severity of such pathology. In the case of a purple tongue, it allows us not only to diagnose blood stasis, but also to ascertain its degree of severity. For example, a tongue may be only slightly purple, which means that the blood stasis is mild. By contrast, if a tongue is deeply purple, it indicates that the blood stasis is severe. There are two pathological purple colors, bluish purple and reddish purple. Bluish purple indicating blood stasis associated with cold and or yang deficiency, and reddish purple associated with heat. Therefore, the bluish purple tongue develops from a pale tongue, while the reddish purple tongue develops from a red tongue. Yang deficiency, cold or pale tongue, because cold congeals blood leading to blood stasis. If there is heat, manifested by a red tongue, heat condenses blood, leading also to blood stasis. This is a tongue that is severely bluish-purple, more so on the left side. This patient had a large myoma. Just as in the case of the pale and red tongues, a tongue may also be partially purple in a specific area. The three areas that are commonly partially purple are the sides, the chest area, and the center. Purple sides indicate blood stasis in the liver or in women in the uterus. A purple color in the chest area indicates blood stasis in the heart or lungs, in the sense of Western pathology, or in the breast in women. A purple color in the center indicates blood stasis in the stomach. So here you have a bluish purple tongue and a reddish purple, bluish purple. Here are examples of bluish purple and reddish purple tongues. More bluish purple and reddish purple tongues. Blood stasis in women. the 4 degrees of severity of blood stasis. Number 1, normal body color. Number 2, purple veins underneath. Number 3, purple sides. Number 4, the whole body is purple. As explained earlier, the chest area on the tongue reflects Western pathology of the heart or lungs, or of the breast in women. When the chest area reflects pathologies of the heart or lungs, these will be very obvious from the symptoms. For example, coronary heart disease, chronic obstructive pulmonary disease. In women, the chest area may reflect a pathology of the breast, especially when the purple color is unilateral. In women, a purple color in the breast area often appears in breast cancer, as this usually occurs against a background of blood stasis. There is a correlation between the purple color of the breast area and the prognosis. The darker this area, the worse the prognosis. If the breast area on the tongue is purple in women who have not been diagnosed with breast cancer, this sign may indicate a tendency towards the disease before any symptoms manifest. For this reason, observation of the chest area in women is particularly relevant. Observation of the tongue should always include observation of the veins under the tongue. Under normal circumstances, the veins are not distended, not dark, and one can barely see their outline. Although a purple color of the veins under the tongue is clinically very significant, other abnormalities may also be observed, such as veins being distended and shiny. When the veins under the tongue are purple, it indicates the early stages of blood stasis. The sublingual veins, therefore, become purple before the rest of the tongue. A purple color of the veins under the tongue gives an early indication of blood stasis, particularly in the upper and middle burners. In modern China, doctors also correlate the appearance of the sublingual veins with modern diseases such as hypertension and arteriosclerosis. Distended sublingual veins means Qi deficiency. If the veins are distended and dark, it's blood stasis. It's an early indication of blood stasis in the upper burner, lungs, heart, but also in the liver. Too thin sublingual veins is yin deficiency. Swollen, white, sticky, dampness and stasis of blood, the P syndrome. Reddish, shiny sublingual veins, damp heat. Yellowish, turbid dampness steaming upwards, white, slippery, cold dampness, dark, dry veins, severe yin deficiency with empty heat. So here you have a tongue that has normal sublingual veins and another tongue with dark sublingual veins. Okay. Sublingual veins are slightly dark on the first tongue. Okay, then the sublingual veins are dark and distended, and the bottom tongue sublingual veins are very dark on the left side. Yellowish, shiny sublingual veins indicates damp heat. Very slightly purple sublingual veins on the right side. Dark purple veins. There is blood stasis in the heart and or lungs. In some cases, it can indicate hardening of arteries in the brain. Distended, dark, and crooked veins means hardening of the arteries, high blood pressure. If the veins also stick out a lot and look like earthworms, the disease is severe. The dark nodules on the veins, like small nodules like rice or wheat grains, indicate hardening of the arteries and heart disease. Thank you very much for your attention.